Welcome to another episode of Talk to Us on channel NE24. I am Minu Chaudhary. This program aims at introducing various personalities from Barak Valley to the audience. Dental medicine, also known as dentistry or odontology, is a branch of medicine focused on the study, diagnosis, prevention and treatment of diseases, disorders and conditions of oral cavity, particularly teeth, gums and the surrounding tissues. Dentistry encompasses a wide range of practices from preventive care and restorative procedures to surgical interventions and cosmetic treatment. Today we have with us in our studio Dr.D.S.Bhattacharya, BDS. Welcome sir to our studio.
Thank you. It's my privilege to be with you.
Thank you. At the very outset, we would like to introduce our guest to the audience. Sir, from where did you do your college?
I have done my college from Guru Nanak Institute of Dental Science and Research, West Bengal University of Health Sciences from Kolkata.
Why did you choose dental medicine as your field of study?
See, actually I was having the aim of doing MBBS only, but in our system of education, we have a competition while giving the entrances.
Okay.
So my fate struck to BDS, and then I choose BDS. Now I'm doing well I am very well satisfied with my profession.
Okay. What do you actually mean by dental medicine?
Dentistry, if you tell, is a subject dealing with entire orofacial region.
Okay.
It starts from below means skull up to your neck. It covers up to your neck, below your skull. Every bone is covered in dentistry. We have oral surgeons who used to treat all the fractures and everything inside the craniofacial region. Also, it comes under dentistry. Surgical interventions are there, cosmetic interventions are there, some facial upliftment or cosmetic fillers and botox. They are also dentists are doing all these treatments also. Cosmetic parts they are seeing in dentistry. So now it has become a very vast science. If you consider it has become a very vast science.
Okay. Sir, I would like to ask you, at what age do teething actually starts in infants?
In infants, it gradually starts. In a normal course, it starts at 5 to 6 months of age, and it may extend up to 9 to 12 months also. But sometimes some infants born with a teeth,
okay,
which we call nettle tooth.
Okay.
And sometimes after 1 week also some teeth comes to the mouth. We call it neonatal tooth. So some anomalies are there, but in gradual normal course it starts from 6 months and it may extend up to 1 year also.
Teeth in infants are called milk teeth.
Yeah, deciduous. If you go for a medical term, it is called deciduous tooth.
Okay. So at what age does these teeth start falling?
Falling age is around 5.5 years, and it may continue up to 13 years. All the 20 deciduous tooth, gradually it falls, and time starts from 5.5 years and it extends up to 12 to 13 years.
How to maintain teeth for young?
See, we have to avoid sticky foods, which is the main thing for caries, and regularly we have to brush our teeth. We have to maintain oral hygiene. We have to avoid junk foods. We have to clean our tooth, and at least in 6 months we have to visit one dentist, so that if any problem is there, it can be rectified in very early stage.
Brushing is done either with fingers or brushes or traditional items like neem sticks and all.
No, it should always be done with brushes, and it should be 2 times, because interdental spaces cannot be cleaned with a finger or a neem stick or any other things. And not only brushing, now we are recommending flosses for cleaning the interdental spaces. Brush is also insufficient, so flosses are needed to clean the interdental spaces.
Cavities in teeth is a common problem. How do you safeguard? How do you suggest that the children and adults safeguard themselves?
Children, I used to suggest one thing. In infants, stop at least feeding at night. Either it is breastfeeding or it is bottle feeding. You stop after 18 to 20, in 18 to 24 months it should be stopped. At least at night time, because it increases the chances of cavity in infants very much. And in adults, at least brush 2 times teeth, 2 times. And one more thing, you have to maintain oral hygiene and avoid the sticky foods, what we used to say, chips, chocolates, pastries. These sorts of foods should be avoided. And if you take also, at least we should clean our teeth as soon as possible.
Brushing after every meal, that is what you said.
Brushing after, at least with toothpaste 2 times. And if you have sticky food, I'll recommend at least you rinse or brush without toothpaste, at least after taking sticky food.
Paideia is a disease commonly found in many individuals. What is the main cause?
See, this paideia term has now become obsolete.
Okay.
The disease starts from gingivitis and it extends up to periodontitis. Gingivitis means if the disease is restricted to gums, and if it continues up to the periodontal ligament, means the tooth is covered inside the bone, and surrounding the bone, the teeth is attached with the bone with the periodontal ligament. So if the disease extends up to the periodontal ligament, then we call it periodontitis. So there are 2 terms, gingivitis and periodontitis. And gingivitis extends up to periodontitis. This is the main cause. Is without proper treatment of gingivitis, it may extend up to periodontitis, and it may leads to falling of your tooth. The teeth becomes loose in your mouth, and it comes out from your mouth. The main thing is that the proper oral hygiene is not maintained, proper scaling is not done at in time. So my suggestion is, if you have bleeding gums, or if you see that your teeth becomes slowly mobile, then go for a oral checkup, at least to your nearest dentist, whosoever is there. Go for a checkup, and it can be at least reversed.
Okay. Do you specialize in dental implants?
Yeah, I do dental implants in my clinic, and it's a very upcoming thing in dentistry, and we can at least replace the missing tooth with a very able thing, which is implant.
What is the recent development in dentistry?
See, this dentistry has developed a lot. Now with AI technology, we can the crowns and bridges, what we do, we are preparing the crown and bridges here. We take a scan, we send it to lab, they form a computerized design, and they form the crowns and bridge, and they deliver it to us. We fix it in the patient. So development in technology, development in science, both are going simultaneously in dentistry.
Sir, how do you make the public aware of safeguarding these dental problems?
See, at least maintain 2 times brushing is very essential. And one more thing, at least avoid chewing pan, tobacco, and all these tobacco materials. It should be avoided. At least in 6 months or 1 year, visit one dentist, and if you feel some problem is there, as soon as you go to the dentist, it can be restored in a very early stage. It will be well maintained throughout your life.
Thank you, sir, for your valuable time.
Thank you very much.
Viewers, see you next time with another episode of Talk to Us. Till then, bye.